All right, we're recording.
Oh, man.
Can we say hi?
Hi.
And you're from?
I'm from a little tiny town called Lakeview, Oregon, in eastern Oregon, and we drove, so that's why I want to go first, because we're going to leave, because we have a long drive home today and tomorrow. And my name is Michelle Williams. I'm videotaping. I wasn't going to, but my sister might be watching. My sister had...
Wait, this is called, you want to do a shout-out?
Yeah.
Now, I promise, here's what I do. I promise I'll put your video on the internet tonight.
Okay.
So this will be one I'll promise to do.
Okay.
And so you tell her to watch, and you do a shout-out to your sister, right?
Hi, Kelly. 7 pounds.
Good. You had surgery.
I had surgery.
And before surgery, you were a diabetic.
Uh-huh.
And how's the sugar now?
Higher than it was when I was on medicine, but not high enough to take medicine, I guess. This morning I was 150.
Yeah, so 150, not normal, but before surgery you were taking?
I was taking metformin and glipizide and Actos.
So 3 medicines before. And what were your normal sugars most mornings on those 3 medicines?
Well, I'm not a very good morning person, so sometimes 137.
Yeah.
I was never a very good morning
now
person.
She's not quite cured of the diabetes today, but she's off 3 medicines, and we predict that in the next several weeks your diabetes will be gone.
Yay!
Let's just say that again. That's cool. Diabetes, just, #1 cause of acquired blindness in the United States. Stroke, heart attack, amputation, kidney failure. And that, as of a couple of days from today, we hope is gone. Good. What about, you want to say a little word about the surgery? Did it go okay?
The surgery went good. Better than I thought. I was pretty nervous ahead of time, but better than I thought because I'm a thrower-upper, but I didn't throw up.
So not too much nausea after the surgery?
I had 1 dose of Finnegan because I was maybe more nervous than I should have been thought, but I haven't had any nausea since at all.
Great.
So I think that went really well for me because that was one of my concerns. Because it didn't seem like a good idea to throw up after you had this surgery to me, but so I didn't.
But it's actually nothing to worry about. You can throw up afterwards. We expect most of you won't, but...
I didn't. I had a really good week. I think the 3rd day after surgery, which was Friday, I woke up in the morning and I thought, what have I done to myself? And I called and talked to Sandy and I took some Benadryl and then I took some Friday night and since then I've been really good.
So you did have
really
1
good.
day of some pain?
Not so much pain. I just felt kind of bloated and swollen up.
Okay.
But it wasn't really a lot of
I'll edit that part out of it.
Okay, go ahead. But it really wasn't nothing as bad as I thought it could be.
Last Wednesday.
Wednesday.
So you're 6 days post-op.
Mm-hmm.
Good. And do you remember how many minutes the surgery took?
Well, I was
46.
46.
And that was because you were hard.
Yeah.
Yeah.
Built low to the ground for speed or something you said.
That's right.
I don't know what that means. I was hard.
It was challenging, right. So,
and he only had 3 people to do. He didn't have to rush.
Right. So I was, had a cup of coffee. No, it was just very hard to do the surgery. Questions? Anything that's not clear that we should answer this morning? No, not you.
So I'm going to ask you a question.
No, you can't now.
Say questions.
No, it's for her. Because then she's driving to Oregon. But your questions can come later.
So I called you once about my blood sugar because I've been watching them for 5 years now. But I guess I'm just going to give up worrying about those. I'll keep checking them in.
Well, you should think about it the way we would say we're monitoring the landing of a jet airplane.
Okay.
We expect it to come in for a landing. We land this jet every day, so we're pretty confident about the landing. But you still should monitor it. And our expectation is you can already see that you're just about where you were pre-op, but with no medicine. And so we're expecting that blood sugar, blood pressure, cholesterol, joint pain, shortness of breath, all those things to kind of gradually glide in for a landing.
Good.
So that's what we expect. So you should monitor those things because nothing's 100% in medicine or in people. It's not like we're stamping out a machine product. You are a person, so we monitor those things for safety. But our expectations are, because we do this so frequently, is it's all over. You're not going to be diabetic anymore. And whether it's a week or a month from now, we won the game.
Yeah. So I go see my regular doctor on Friday because he said he wants me to see him on Friday.
Okay.
Is there anything I need to tell him?
Tell him basically there's nothing to worry about.
Okay.
So a lot of people wonder, what blood test should I get or what should he do? There's really nothing to be done unless you're not feeling well. So basically what we expect and predict is you should do well and gradually get better, and no tests are necessary from our standpoint.
Okay.
Lots of doctors who haven't taken care of MGB patients get wound up and draw lots of tests. We haven't found that that's very useful or valuable unless you're sick. If you've got symptoms of something, call me and we'll talk about it. But we don't just get a test across the board. You know, everybody gets something. It's nice because this surgery is pretty low maintenance. Do you mind if we take your staples out on camera?
I want you to.
Okay. And may I have the water here? I'll set that over here. Excuse me. Good. All right. Okay, here we go. Ready, set, and... Ah! She has bruising. Oh. Ooh. Let me just mark where to edit this tape. Actually, not yet. But with your diabetes...
I don't do this part. I'm not into that.
Now, have you ever been to a doctor's office where they have the patient come out and take their bandages off in front of you and take the staples out?
Never.
Only
I've
yours.
never. You think Rick can handle that? No.
We'll see. You're just doing that so that people can see that they aren't writhing in pain.
Yeah.
Well, a lot of people, but that's their biggest fear, is worried about the staples coming out, and it's nice that it's not too bad.
I'll just do mine and that'll be it.
Lots of
Applause.
Yay!